There are calls for the federal government to stop the planned closure of the chronic disease dental scheme. The system pays for about $4,000 worth of dental treatment for people whose teeth have gotten so bad it's affecting their health. The scheme closes at the end of next month, but the one that's replacing it won't be up and running until 2014. Matt Wordsworth reports there are fears that during that period, people who can't afford dental treatment will suffer.
Anthony CARNEY had to learn a long time ago to enjoy the simple things in life. He suffers from epilepsy and lives off a disability pension. The softly spoken 28-year-old dropped out of high school at year 10 due to a combination of learning difficulties, ADHD and bullying. His mouth is also riddled with broken teeth.
When I was 3 years old, I had nine teeth out. As far as I know, I've had teeth trouble ever since I've had teeth. So.
How many do you need to get out?
Off the top of my head, 17 or 19. If you go and have a look at my truck, I've got a bottle of clove oil ready to go. It's always in arm's reach.
A bottle of what?
Clove oil.
What's that for?
It's pain.
It's an old toothache remedy.
Yeah.
You're regularly in a lot of pain?
Yeah.
The federal government announced in August that people like Anthony would have 12 weeks to finish their treatment before the chronic disease dental scheme would be closed. He missed the deadline to apply for the extra 12 weeks, but it wouldn't have mattered anyway. So this scheme closes December the 1st, so what chance of it all being done?
No way. No in hell.
And what chance of you being able to afford to do this on your own without this scheme?
It's not doable.
The decision to close it was made in conjunction with the announcement of a new $4 billion means-tested scheme. Every 2 years, eligible children would be entitled to $1,000 worth of dental care. Adults on low incomes will also be covered.
They'll be able to use that entitlement in a place like this, in the public dental system, or they'll be able to take that entitlement with them to their local dentist.
The problem for the government was the increasing cost of the chronic disease scheme, which had blown out to almost $1 billion a year. The new scheme, though, doesn't begin until January 2014 for children and July 2014 for adults, leaving a gap of between 13 and 19 months.
Obviously there is a large gap from the time of the closure of the chronic disease dental scheme, which is 30th November, to those schemes in 2014. And the association is concerned that during that period where there is not any federal funding for dental care, that it will compromise, the quality and health of patients within Australia.
Associate Professor Hans Zollner is the head of oral pathology at Sydney University. He's started an online petition to save the chronic disease dental scheme and has more than 10,000 signatures.
These people have been deprived of access to basic care for so many years. Now they've finally had some care and the scheme's going to be taken away from them, which is frankly tragic. And 80% of these people are not very well off. They're healthcare card holders, despite what the Minister says, that these are all millionaires. It's complete nonsense.
The concern is shared by one of the country's largest health support groups. Diabetes Australia says 1 million Australians have diabetes, and while it's not widely known, the disease is linked to dental problems, and the gap between schemes is not good enough.
Well, it won't. It simply won't meet the prevention need and the ongoing care need that hundreds of thousands of people with diabetes, adults, are going to need in terms of preventing periodontal disease and problems and managing them better.
Health Minister Tanya Plibersek says about $364 million over 3 years is being offered to the states to cut public dental waiting lists to help accommodate some of the people leaving the chronic disease scheme.
It can flow as soon as the states and territories sign on the dotted line saying that they will not reduce their services.
Hans Zollner says a previous boost from the Commonwealth wasn't effective.
The trouble was that it didn't really make any difference. It didn't really work. And the reason why it didn't work is because more money in the public system doesn't buy you more dentists. Private practice is lucrative, private practice is more interesting. You don't get stuffed into mostly emergency type care as public dentists do, and so it's almost impossible to attract more dentists to work for the public dental service.
I'm just going to have a quick look around there.
The Dental Association says the gap between the systems is simply a cost-saving measure.
The current federal government has made an election promise to get the budget into surplus, and as a result of that, it's been trying to cut costs here and there and everywhere.
But it leaves people like Anthony CARNEY to pay the price. What change would it make for you to have new teeth?
Have new teeth would be amazing. I struggled at school. I'd be with new set of teeth. I'd even think about going TAFE. You know, catching up what I've missed out on and getting a better job. Eventually getting off pension. It'd mean a lot. It'd change a lot of things.
Matt Wordsworth reporting.